And Shauna on Fly FM, Kingston's morning show.
All right, good morning. It's 8:51. Gorgeous sunshine on your Wednesday.
Yeah, it looks like we're going to keep this sunshine around today, eventually up to a high of 10 degrees. And for right now in Kingston, we are up to 6 degrees. Family Matters, brought to you by Frontenac Community Mental Health and Addiction Services. Today we talk more about seasonal allergies. Dr. Ellis, an associate professor with the Queen's School of Medicine, joins us today. So this spring, from what we've been reading, could be the most miserable one ever for those of us with allergies. Can you explain why that might be?
So there's been a lot of research recently that has documented and projected that global climate change is definitely affecting the amount of pollen that we can expect to be exposed to. There's a number of different factors involved, but there's no doubt that we can expect ongoing issues with increased amounts of pollen in the air in both tree, grass, and ragweed seasons, and it doesn't look like that's going to be reversed anytime soon.
So for people like you who, do all this great work when it comes to allergies, with the situation worsening, I guess, the clock is ticking and you're really trying to look for some kind of medical breakthrough to try to once and for all not just treat allergies, but to cure them?
Absolutely. So the new world order, if you will, the way in which we're moving forward with allergy research is to not just come up with better treatments that control symptoms, but really get at the heart of the allergic response and try to reverse the process. So some of the studies we're doing right now down at Kingston General Hospital involve new vaccines for allergies. So treatments that really try to reverse the process and take away your grass or cat allergy or ragweed allergy, as opposed to just mitigating the symptoms and making you feel better for the season. What we really want to do, and what the majority of researchers are working towards now, are new cures for allergies.
All right, so until you come up with that, which hopefully is soon, for those of us with allergies, and as you say, the conditions just seem to be getting worse, and with climate change, this isn't going away. What can we allergy sufferers do in the meantime to try to deal with the symptoms that we may experience?
So first and foremost, it's really important to determine what is it that you're actually allergic to, because there can be conceptions about this thing gives me allergy symptoms, I feel better around this, but really getting properly tested to know exactly what you're truly allergic to is very important. Certainly, if for mild intermittent symptoms, the over-the-counter antihistamines, the more unfortunately expensive but more effective ones like Reactin and Claritin and Allegra are good first options. When that fails, prescription nasal corticosteroids are the next step. But truly what we have currently that offers the best hope for an actual sort of cure or control of your symptoms would be allergen immunotherapy, or what many people refer to as allergy shots. And that involves being assessed by an allergist who can set you up with a treatment plan that actually involves a series of weekly injections that trains your immune system to ignore the things you're allergic to rather than reacting to them.
Okay, and do you have any special advice, Dr. Ellis, for parents if they have a child who has an allergy? Do we treat them differently?
So certainly, again, it's important to realize that there are certain medications that are still safe to use in children as opposed to ones that aren't. So it's important to check with your physician. And again, being assessed by an allergist can really make all the difference in terms of determining what are the actual triggers that are responsible for the symptoms. Particularly in kids, it can be hard to sort out the difference between frequent colds versus actual allergies. And so having a proper assessment can make a big difference there.
Now, you mentioned all this research and work that you're doing at KGH. So, cure, when?
So, again, it's always hard to tell when you're looking at new treatments. They have to go through a series of different stages, phase 2, phase 3 development, and then large trials that involve, a big portion of the population. But I would say with the current vaccines that we're looking at, if all keeps going as it has been, some of these treatments could be available in the market as soon as 5 years from now.
Well, that's good.
Yeah.
Are you still, people get involved in this, or is it kind of through allergists, or how does that happen?
So in terms of participating in some of our research trials, you can contact the allergy office at 546-5300 anytime and speak with our team. But as you know, Fly FM's wonderful at doing our ads for us, and there's also a website, www.kingstonallergy.ca, and people can check us out and see if any of the studies we're doing right now are the right ones for them.
All right. Thanks, Dr. Ellis, for coming in this morning.
Thank you very much for having me.
Hope you're wrong about the allergies. All the words suggest not going to be great. It's 8:55 nonstop.